a lot of my patients couldn't take their prenatal vitamins. And they worried so much about that. And, morning sickness or just nausea of pregnancy tends to peak at about 2 months. And so those first few weeks when you don't even know you're pregnant, most women are not terribly nauseated till they get just a little bit further along. And so I always used to tell my patients, it's more important that you eat. And so if the prenatal vitamin is making you nauseated, make sure you take it with food, maybe take it before you go to bed. If you can't take it at all, then worry more about getting overall nutrition than taking that vitamin.
Welcome to Eat Your Greens with Dr. Black, where we discuss plant-based nutrition for the whole family. Thanks for listening. Welcome back to all my regular listeners. You all know how much I appreciate your support. You're the reason that I keep doing this. If this is your first time listening to Eat Your Greens, if you only just discovered the podcast, I'd like to take a moment to welcome you to the family. You have come to the right place if you're confused about all those conflicting messages out there about nutrition and what's the best diet to follow. If you really want to know how to optimize your own health to help your kids eat healthier, and if you just really want to do the right thing for yourself and your family. And let me be clear, every family that I've come in contact with throughout the course of my pediatric career wants to do just that. But it's confusing. So I created this podcast to help you find the answers you're looking for. I'm your host. I'm Dr. Angela Black. I'm a board-certified pediatrician. I've been in practice for over 20 years. And my passion is using evidence-based guidelines to help inform and empower you about how to live the healthiest life possible. Now, how am I going to do that today? Today, I am joined by an amazing guest, a board-certified obstetrician-gynecologist and lifestyle medicine physician, Dr. Vicki Petz Kasper. Dr. Petz Kasper and I are going to talk about the importance of good nutrition starting even before conception. So if you are someone who is planning your next pregnancy, hoping to become pregnant in the near future, this is the podcast episode for you. We're going to talk about things like what's the worst food to eat if you have morning sickness. The answer might surprise you. How much fish is safe? And did you know that some cheeses even can be a risk? What happens to the baby when mom has gestational diabetes? And how can you reduce your risk for developing this? How does stress affect the developing fetus? And what can moms do to reduce the risk of some birth defects? Dr. Petz Kasper and I are going to answer all of these questions and more on this episode of Eat Your Greens with Dr. Black. Thank you for joining me today on the Eat Your Greens podcast. I am really honored to welcome a special guest. I have Dr. Vicki Petz Kasper with me today. Dr. Petz Kasper is a dual board-certified obstetrician-gynecologist and lifestyle medicine practitioner. And I had the pleasure of meeting Dr. Petz Kasper last year at the American College of Lifestyle Medicine Conference in Denver. And we hit it off and got to be good friends. Dr. Petz Kasper has a podcast called Healthy Looks Great on You. It is an excellent podcast that's really focused on lifestyle medicine for the adult population. And I had the honor of being a guest recently talking about pediatric nutrition. And so today I get to have Dr. Petz Kasper join me on Eat Your Greens with Dr. Black, and we're going to talk about nutrition in pregnancy. So Dr. Petz Kasper practiced OB-GYN for a good 20 years. And so she has a great wealth of knowledge about taking care of expecting moms and their babies. She is currently the Chief Medical Officer of Equilibrium Medical. That's a lifestyle medicine telehealth practice that's based in Arkansas and Tennessee. It's a new endeavor, a new adventure for Dr. Petz Kasper, and she will be starting to enroll patients in early June of 2024. So if you're in the Arkansas and Tennessee area, if you're interested in how you can develop healthy lifestyle habits to promote your overall health, Dr. Petz Kasper is the doctor for you. So thanks a lot for joining me today.
Thank you. It's so good to see you.
You too. So we're going to just talk about some great advice for expecting moms and how they can really take the best care of themselves and optimize the health of their newborn baby. So just start off, what are your top 3 pieces of advice when a new expecting mom comes into your office and she wants to know how to eat right to take care of her baby?
Well, I think it's important to have good nutrition even before she conceives. And so ideally, it should start preconceptually so that particularly they get enough folic acid because that's associated with neural tube birth defects. And a healthy lifestyle and a healthy diet are important for the whole family. I think women are typically more motivated to eat healthy when they're pregnant. Even I've seen people with substance abuse problems who are more motivated to stop smoking or to stop using some harmful substance when they're pregnant. And so that motivation is there when you're taking care of someone else. So I think to start eating healthy prior to conception is important. And then while you're pregnant, of course. And then thirdly, to continue that afterwards. As an example to your children as you're raising them, your diet's not going to be terribly different while you're pregnant, even though your needs are higher than it is on a normal day.
What about, I have families who want to know things like they're always focused on protein. Do you have any specific advice about protein?
Yeah, protein is a big one because it really truly is hard to get enough protein, especially if you're eating a plant-based diet. And it's possible. It just takes a lot of intentionality. But the recommendation for pregnant women is 71 grams a day in the second and third trimester. And that is a lot. It's 10 to 35% of the total caloric intake. And, but we do recommend getting it from healthy sources, not supplements, not using protein powders and things like that.
When you talk about healthy sources of protein, what sorts of ideas do you have for moms?
Again, it's really the same as it is for anyone else. It's to eat lots of fruits and vegetables, lots of whole grains, and of course, nuts and legumes and beans are high in protein. If you're doing plant-based, you can also incorporate tofu and tempeh.
I love that. What about fish? A lot of people hear that fish is healthy. It's a good source of omega-3s. And I know that that's an important thing to get for pregnant women. But fish has a little bit of a double-edged sword, right? It has some health benefits, but there's also some ways that we should be cautious with our fish intake.
That is absolutely true. The American College of OB/GYN recommends that you get 20 to 35% of your diet from fat. And we like for that to be healthy fats. And of course, you can get fats in things like avocados and nuts and things like that. But also, you need those long chain polyunsaturated fatty acids, those omega-3s like DHA and EPA. And fish is a great source for that, especially fatty type fish. And that's important for retinal development. It's important for fetal brain development. And again, the American College of OB/GYN actually recommends that pregnant women consume 8 to 12 ounces of seafood per week. But you have to be very conscious about mercury intake because any more than that, and you can have excess mercury, which is actually toxic to the developing fetus.
So just enough, but not too much.
Yes.
And also not raw, right? Not sushi.
Correct. And, it's funny because I did practice for 20 years. And when I was practicing, there were some recommendations about what to do and what not to do, but not as many as there are now. You have to be so cautious. There's so much more knowledge now about things like listeria that can cause pregnancy loss, especially in the first trimester. And so I think it is challenging for women because, they can't eat soft cheeses and they can't eat deli meat and things like that.
Right. The soft cheeses was a new one for me. And I don't even remember if I knew that back when I was pregnant a couple decades ago. I don't remember that recommendation. And by soft cheeses, we're talking about brie and even some blue cheeses. And here in Central Texas, we eat queso fresco or queso blanco. It's a big favorite cheese in our local Mexican population. But those are soft, unpasteurized cheeses that pregnant women really need to watch out for safety.
They do.
When it came to supplements, so talking about things like omegas, a lot of people want to take a fish oil supplement. Is that something that you routinely recommended in addition to their prenatal vitamin? What supplements did you usually recommend to your patients?
I think it's more important to look at the content of the prenatal vitamin, because if someone is choosing not to take in any seafood, then they are going to want to get the DHA and the EPA. And those are actually available as supplements within the prenatal vitamin. So they can just buy a prenatal vitamin that contains those supplements that are already in it. That way you're not taking multiple things a day.
I know other good sources are things like flax and chia and hemp seeds, although that is more of the ALA that has to be converted in our body to the DHA. So it gets a little complex, a little confusing, but they're good sources and they're healthy sources to add to your diet. But even things like that I didn't realize had that, like broccoli or cauliflower, cantaloupe, spinach, walnuts are a great source too. So there are a lot of healthy dietary sources, but a little bit of fish, not too much. And if you just don't want to eat fish, or you don't like it, or it's not part of your diet, taking specifically a prenatal vitamin that has those omega-3s is important.
I think
and that's
so.
good for the brain development, right? Specifically. I think
Right.
vision too, but that's part of
Yes.
the nervous system.
Yeah, the retina. As far as micronutrients, you have elevated needs for calcium, magnesium, phosphorus, potassium, zinc, vitamins A, C, and K. And again, we always say eat the rainbow, eat that variety of fruits and vegetables, and you'll get the vitamins and minerals that you need. But a lot of women are deficient in iron, which causes iron deficiency anemia. And so the needs for iron are elevated. Some women even have to take an iron supplement, which can be really hard on your system. So if you do have nausea pregnancy, you want to avoid that. And it's important to know that iron is better absorbed with vitamin C. So thinking about those citrus fruits in particular. And then you think about the baby growing, and one of the things that grows is their bones and their skeletal system. So they need calcium, and you don't have to worry about it because they will take what they need from you. So moms who don't get enough calcium are not going to have calcium deficient babies, but they are going to have more of a strain on their own bones. So it's important to get at least 1,000 milligrams of calcium a day, as well as vitamin D. Vitamin D promotes cellular function as well as the immune system and bones, and you need 600 international units a day, and that's contained in most prenatal vitamins. But you need to check that. And then another thing that's interesting is choline. And I think of acetylcholine as a neurotransmitter. So choline's important in the development of the central nervous system. There's a little bit of choline in navy beans, Brussels sprouts, broccoli, and spinach. But a lot of women do need some supplementation there. So you're going to find that again in your prenatal vitamin. And then zinc is important for the baby growing and as well as the development of the nervous system. And that's found in whole grains and fortified cereals and in legumes. And then lastly would be iodine, and that's important for the thyroid development. And you can get that in salt, but it's one of those double-edged swords again. You need enough and not too much.
And not too much. Also, seaweed. So if you have the Japanese wakame salad, which is a seaweed salad, or just they make them in a snack package, the nori seaweed that they use to roll sushi. You can get them in little snack packages. My kids loved those growing up, and they're good sources of iodine, but you're right, you don't want to overdo it. Going back to choline, soy is also a good source of choline. So including some tofu and edamame, other soy products is a way to get choline in your diet.
And another vitamin that you want to avoid excess in is vitamin A. It's important for cell division and organ development and immune system and the development of the visual system, but too much is toxic. And so good sources in your diet are carrots, leafy greens. I know you love that. Broccoli, cantaloupe, and squash. And I think for people who are on a completely plant-based diet, it's important to note that vitamin B12 needs to be supplemented.
Always. And there is evidence that expecting moms can have a healthy pregnancy with a strictly vegan diet. It can promote health, and they've seen some positive effects on both the mom and the baby's health. although you have to be extra cautious about some of those things and making sure that you're getting them in supplement form. Some of the things like omegas, it's a little harder to find them in sufficient amounts in a vegan form. If you don't want to take fish oil, you have to be extra careful about getting it from an algae source or the seeds and also your prenatal vitamins. So definitely women who want to do a vegan diet while they're pregnant should sit down and have an honest conversation with their obstetrician and make sure that they're getting all of their nutrition needs met.
I agree with that.
When I see newborns in the office, it's pretty common for me to see a baby who was born to a diabetic mother. So there's something about pregnancy that causes women to be at higher risk of developing type 2 diabetes. When it's just limited to pregnancy, we call that gestational diabetes, gestational meaning during the pregnancy. And so I see a fair number of babies coming in who are born to diabetic mothers, and that sets them up for some health risks. What are some of the complications that newborns can have or fetuses can have when the mother develops gestational diabetes?
The big one that we worry about is what we call macrosomia. And macro just means big, and somia is our body. And so infants of diabetic mothers can be disproportionately large. So in a normal vaginal delivery, the head comes out first, and then what we call the anterior shoulder, that's the top shoulder, and then the posterior shoulder. Well, in infants of diabetic mothers, the head may be a perfectly normal size, but then they've got these big linebacker shoulders, and they can get stuck up under the pubic bone, and that's called shoulder dystocia. And it's a very scary situation. If it's mild, you can just put some pressure above that pubic bone and push that shoulder out. In more severe cases, sometimes you have to get the mother's legs back to sort of change the angle of the pelvis. And you even have to go in and do some rotational movements or pull the arm out. And that all increases the risk to the fetus, not only for physical injuries like breaking the clavicle or damaging the nerve to the arm, but even prolonged time of delivery between delivery of the head and delivery of the body, which can deprive the baby of oxygen. And so that's a very serious complication, and that's why it's so important for women who have gestational diabetes to maintain good control. And then the other thing that we see is because the baby is sort of floating in all that sugar, their pancreas is working overtime because their pancreas is normal to put out all this insulin. And so the minute they're born and that sugar supply is cut off, these babies tend to get dramatically hypoglycemic, which is more in your realm than it was in mine. But that's in that immediate period after birth. And they can even have a seizure because their blood sugar's too low.
Right. And I have seen, babies who had those issues. And the most severe one, I had a baby whose report said that their blood sugar was as low as 5. And, a normal blood sugar is 70 to 100. So that was life-threateningly low blood sugar. They can be poor feeders, so it's really hard to get them to breastfeed. Even bottle feeding can be difficult. And then on my end, they tend to drop a lot of weight quickly. And then we're worried that they're not feeding well, they're losing too much weight. And especially moms who want to breastfeed, that process can get interrupted because we're having to supplement with formula to get their weight back up until mom's milk is in. So it does set them up for quite a cycle of interventions and concern and worry and stress in the immediate newborn period, those first 2 weeks.
Absolutely.
What can moms do to reduce their risk of developing gestational diabetes?
Well, one of the biggest risk factors for gestational diabetes is your family history. So you need to choose your parents very wisely.
Sage advice, yes.
No, in reality, the other big risk factor is weight. And so again, if we try to back up and start in the preconceptual phase, then it's important for women to enter pregnancy at a healthy weight. And then once they are pregnant, some women, start saying they're eating for 2 and don't realize that one of them is the size of a golf ball. And so they gain excess weight. And so maintaining within those normal parameters is the most important thing they can do. And if a woman is overweight when she gets pregnant, then her weight gain is going to be much less than someone that's of normal weight at the beginning.
So being sure to follow your doctor's advice and the general advice for just healthy lifestyle habits in general and eating the right amount. I believe the amount of calories that a woman needs if they have a single baby, not twins or triplets, is something in the range of 300 to 350 extra calories in the second trimester. So the first trimester, the baby is less than a golf ball size, so they're not really using many calories. The second trimester, they're a little bit bigger and using more energy, so about 350 calories. But when you think about that, that is, I believe, around the size of a small glass of fat-free milk and a half a sandwich. So we're
It's
not talking about eating tons of extra food when you're eating for two, like you said. One of
Yes,
them's the size
not
of a
very
golf
much, and
ball.
those calories need to be nutritious calories. The point is not to have empty calories to just fatten the baby up. The point is to have nourishing calories that promote development. And I think that's right. And it's not just eating, it's also the other pillars of lifestyle medicine. You know, we know that sleep deprivation increases our serum glucose levels. And so people who have difficulty sleeping tend to be more prone to become diabetic later in life, and they are definitely more prone to be overweight. Of course, pregnancy is not ideal conditions for sleeping because your bladder wakes you up and your back hurts and you can't get comfortable, and so a lot of that can't be helped. But practicing good sleep hygiene, I think, is important, and so is maintaining physical activity. Whatever level of exercise that a pregnant woman is used to before she's pregnant, almost all of the time she can continue that. And so I think it's important to maintain physical fitness because that's going to help maintain a healthy weight as well.
And then, of course, there are the other lifestyle medicine pillars like social connection and stress reduction. All of those contribute to our ability to make good, healthy decisions in terms of what we're eating. I know I have a history of being a stress eater, so stress management is really important in that process to the extent that you're able. I mean, there's only so much stress that we can manage, but as much as you can, trying to reduce your stress.
That's true. And there's so much about pregnancy that really can't be helped. And I mentioned sleep is one of them, and stress is another one. I mean, women are just going to worry when they're bringing a new life into the world. There's a plethora of things to worry about, even when you're not pregnant, and all of that gets magnified when you are. So, like you said, you just have to do the best you can do. But I do think connections are important. And it's nice if a woman can make those connections prior to pregnancy and for sure prior to delivery, because postpartum can be a very isolating, lonely feeling time. Women tend to have baby blues and even some weird recurring thoughts that are invasive, and they don't realize that's normal if they're not out there talking to other women. And sometimes just being connected to other people to go, oh, yeah, I had that too, is very stress relieving.
I know you recently did a podcast episode all about postpartum depression, or also called baby blues. And some of the statistics are pretty impressive. It's more common than people think.
Well, and those numbers have risen dramatically since 2020.
Right. Along with, well, depression and anxiety for everyone, right? It's just
Sure.
add in the hormone storm of just having given birth, and you have yourself a tough time for many people.
It really is.
We do screening on when we have infants come in at the 2, 4, and 6 month well checks. When they come in for their checkup and their vaccines, we screen moms for postnatal depression and try to help them find resources for help if they haven't already established care with their doctor to talk about it. So it's definitely an issue that we're aware of and try to help the moms with.
And I'm really impressed that you do that because not everyone does. My daughter has two babies, and with her first one, every time she went in for an OB visit, and when she left the hospital, and when she went back for her postpartum visit, she had to fill out a questionnaire. And even if she checked some of those boxes, no one ever followed up with her. No one called her. And her pediatrician never asked about it. And then with her second one, her pediatrician really dialed in on that and said, if you ever are struggling and you can't get in touch with your OB doctor, call me. I will help connect you to resources. And so the pediatrician definitely can be that bridge, because after we saw the patient, towards the end of pregnancy, we were seeing them every single week, and you have such a close relationship with your patient. And then suddenly you don't see them for 6 weeks, and then bye, we'll see you in a year. And I think that was unsettling for a lot of my patients. It's like, wait, what? What am I going to do? And sometimes, baby blues are pretty common. They set in quickly and resolve quickly, but postpartum depression can have a little bit more of a delayed onset, and it can certainly have a prolonged impact for that first year. And so I do think having the pediatrician step in and ask proactively is super important. So I'm glad you do that.
We're really blessed here in the Austin area to have access to a program through the Dell Children's Hospital. They have a psychiatry network that has a program that we can really quickly access care for people who are in more urgent need. So we've been very fortunate to have that here.
That's good, because so many places that is a very underserved area, and there's a lack of resources.
Talking about, anxiety and maternal worry, many women worry that their baby's going to have some birth defects or, health issues. And I know that obstetricians screen for some of those issues. What are some of the more common ones that are preventable?
The biggest one that occurred during my career was the one that came out about folic acid preventing neural tube defects, because prior to that, we didn't really know what caused it. And so you saw a lot more cases of what's called anencephaly, which is where babies are born basically without most of their brain and even skull. That's the top part of the neural tube. And then the spinal cord, so spina bifida. And what we learned is that folic acid deficiencies were associated with that tube not rolling up and closing like it does in embryonic development. And it actually closes 26 days after conception. Well, that's long before most women know they're pregnant. And so I feel like now there is quite a bit of awareness that people do need to take a folic acid supplement prior to conception. If they've had an infant previously affected with a neural tube defect, then it's even a higher dose than that. And I think that's one of the reasons that we've seen some of the packaged foods that are so prevalent now be enriched with the B vitamins, including folate, like bread. And, if you eat whole wheat, it has all of those vitamins in it. But when you start refining it and processing it, you strip all the vitamins and nutrients out. And so we saw a deficiency in women, and people didn't realize it. And so I think taking folic acid supplementation prior to pregnancy to prevent neural tube defects is the single most impactful thing that can be done.
And we have a few patients with spina bifida that we follow. And so just so people know what it is, when the lower part of the spinal cord doesn't form properly, the nerves supplying the legs and the bladder and the rectum don't work properly. So patients are wheelchair bound. They have to wear a diaper their whole life. They have to do a catheter to help relieve the urine. They, have lots of urinary tract infections. It's a very life impacting syndrome, and there's no cure. They can do some surgery to help preserve some of the nerve function. And it depends on how severe it is, how much of the nerves are involved. But it's a very significant disorder that's very disabling. And it is fortunately much less common than it used to be, because we're now aware of it and we're more proactive about adding folate into foods. Like you said, a lot of the cereals and breads have it added in. But just being more aware of it as a community and making sure moms are getting their supplementation, so important. I did come across some good, just whole food sources that moms can eat. So even things like dark green leafy vegetables. Anybody who listens to any of my podcasts know that pretty much everything I talk about is going to come down to either dark green leafy vegetables or beans, and beans and legumes are another good source of folate. But even things like peanuts and sunflower seeds, beets, some of the fruits. I didn't realize you could get folate from some of the fruits, but citrus, papaya, banana, mango, and even avocado. So, hooray, you get some nice folate fortified chips and some guacamole, and, you're getting a nice amount of folate in your diet. Sounds good to me.
Even if you're not pregnant, that sounds delicious.
Right. So let's talk a little bit about morning sickness. So did you have a lot of morning sickness when you were pregnant with your babies?
No, not really. I had some. I had more with my second pregnancy than I did with my first. With my first pregnancy, I was just excessively fatigued. And I observed, I don't know that there's any fact or data behind this, but I observed that women were either sick or tired. And with one of my pregnancies, I was more tired, and the other one, I was more sick.
I have this like gut of steel. It takes a lot to make me nauseous and sick, which, on the downside, I can eat anything. It could be the worst greasy, high fat food and I can eat it and I don't feel sick, which is not great for my health. Fortunately, I try to avoid those foods. But I didn't have any morning sickness at all with my pregnancies. And I know it's a big issue for a lot of people. They just start feeling nauseous right away. Sometimes it resolves after the first trimester. And for some women, it doesn't. They go on to have hyperemesis gravidarum and they just feel terrible their entire pregnancies. What are some things that moms who are affected by morning sickness can do to reduce their symptoms?
Well, and, we call it morning sickness, but it's often not just in the mornings. I mean, some people are more sick in the evenings. There's a big variation to that pattern. And actually, 9 out of 10 women have some nausea with a healthy pregnancy. So, if you don't, it's almost unusual. But I think the main thing is to not let your stomach get empty. That seems to be a big trigger. So, pregnant women need to eat frequent small meals. They need to eat snacks like right before they go to bed so that they've got some food on their stomach during the night. And then as soon as they get up, and definitely not to skip any meals. And carbohydrates tend to aggravate nausea more than protein does. And so going back to those protein sources of, grains like quinoa and beans like black beans and lentils and chickpeas and again, we talked about edamame and all the things we talked about. Those protein snacks are going to be better than trying to get a carbohydrate snack. And women tend to, when they do get hungry, they feel that gnawing feeling in their stomach. And so they may just gobble up their food, but it's important to eat very slowly, small amounts, even every 2 hours. I would tell women to eat every 2 hours because that keeps the stomach from distending. One thing that I think is not as well known is to rinse the mouth after eating, just to stop triggering that saliva, because sometimes women get nauseated because they have too much saliva. And then just pay really close attention to what those triggers are. The typical things we think about are coffee, because it has some acidity. I know when my daughter was pregnant, she found some coffee that was particularly made for pregnant women that had less acidity in it. And spicy foods tend to be bad, and smells are the worst. So strong smells, and this usually comes from foods that are high fat. But anything that's real sweet, think more bland. Even the brat diet is what we think about when women are really sick, which is bananas, rice, applesauce, and toast. Salty
Although
food.
those are more high carb foods.
They are.
So
Isn't
they're
that
bland
ironic?
and starchy on the one hand, but
Yeah.
not
Exactly.
protein rich.
But that's after you're already throwing up. The brat diet is after you're already throwing up. The protein is kind of more preventative. And salty foods sometimes tend to settle the stomach, and then just making sure that you're drinking enough fluids, but maybe sip it in small amounts and not, again, don't just turn a glass up and guzzle water and get your stomach all distended, but use a straw, take little sips all day long. For some women, carbonation helps. Lemon added to the water can help. Mint can help. Peppermint tea, and things like that. Other triggers besides food tend to be if the room is stuffy, that's obviously going to make odors worse too. If it's hot or humid. And for some women, even noise, but riding in the car, visual stimuli, lights that are flashing and things like that can be nauseated. And then the last thing I would say is not to lay down right after eating, because that sphincter is relaxed. And if women lay down right after they eat, they tend to get a lot of heartburn and reflux, which is a big problem. And so remaining upright for at least an hour after eating.
I know you were talking about triggers and odors. It didn't make me nauseous, but it really bothered me. I could not go down the laundry aisle at the grocery store because of all the perfumes and the smell of the cleaning products. It gave me a headache. It was so strong.
Right. And the other thing I think when you talked about stress and pregnant women do tend to worry about everything, a lot of my patients couldn't take their prenatal vitamins. And they worried so much about that. And, morning sickness or just nausea of pregnancy tends to peak at about 2 months. And so those first few weeks when you don't even know you're pregnant, most women are not terribly nauseated till they get just a little bit further along. And so I always used to tell my patients, it's more important that you eat. And so if the prenatal vitamin is making you nauseated, make sure you take it with food, maybe take it before you go to bed. If you can't take it at all, then get that folate alone and take that, maybe even a gummy, and worry more about getting overall nutrition than taking that vitamin. And then one other thing that helps some people is ginger.
I love ginger. I put it in probably 50% of everything I eat. One thing I like to do is just slice up fresh ginger, little thin slices. And when I make hot tea, I just drop a few slices into my tea. And it just really gives a little zing to the tea. You're right. If I have any reason to have an upset stomach, then that really helps. And you can also just put a few of those slices in your water bottle with a squeeze of lemon juice, and it's so fresh. So those are some things that moms can do to stay hydrated and also get the ginger to settle their stomach.
I love that. That's great. I mean, some people take ginger capsules and things like that, but a slice of ginger in lemon water, I mean, that's just like the perfect concoction. And, they used to prescribe a drug for morning sickness years and years ago. It was taken off the market before I started practicing. And it was basically vitamin B6 and Unisom. And then when I was practicing towards the end of my practice, they actually put it back on the market under a different name. Because they proved that it was more safe. But vitamin B6 is very helpful for nausea pregnancy. And they even make that in a lollipop form. Sometimes they make a Preggy Pop that has vitamin B6 in it.
Preggy Pop. That's great.
Other things that might help are acupuncture, acupressure. I think most people believe there's probably a huge placebo component to that, but who cares? If you can wear C-bands around your wrist and it keeps you from being nauseated, then by all means wear C-bands around your wrist. People who are ambivalent about their pregnancy are more prone to have hyperemesis, which you mentioned. That's the more serious form where women have to be hospitalized and have IV fluids and things like that. And so if someone's particularly distressed and stressed, then, I think therapy is wonderful. I think therapy is underutilized again. And I always say a journal is a cheap psychiatrist. So for someone who doesn't have access to therapy, at least keep a journal. But one thing we don't recommend is cannabis. And we've seen a huge increase in the use of cannabis in pregnancy with the legalization of medicinal marijuana throughout the country. And it really can be harmful to the infant. So that's not something that's recommended.
Right. It definitely affects the brain development and the nervous system. One other thing that I came across, and again, my listeners will know what a nerd I am when it comes to the gut microbiome, is there is growing data. Of course, everything about the gut microbiome is a new field. We're learning so much, and a lot of research is going on. So this is all very preliminary data, but there is growing evidence that having a healthy, diverse population of gut bacteria in the mom's intestine is going to have a positive effect on the developing fetus. There is some evidence to show that it promotes the development of the nervous system, so the brain and all the nerves in the spinal cord, but also can result in long-term improvements in the metabolic health of children. So not only does having a good, healthy gut microbiome reduce the mom's risks of diabetes, not only during the pregnancy, but beyond, but also of the child's. There's long-term data to show that the children have better metabolic health. And then also allergic disease in particular, higher rates of allergy, eczema, and asthma when the mom's gut microbiome is not healthy. So fascinating research going on in those areas. And of course, I could talk for hours about that and frequently do. So We know ways to promote a healthy gut microbiome it's the same nutrition advice that we give in general. Increase your intake of whole plant-based foods, anything with fiber. So that could be fruits and vegetables, definitely those beans and legumes, but also whole grains, which then you get the benefit of that folate, and nuts and seeds, the whole gamut. The more variety you can get, the better for not only your overall health, the health of your fetus, and the health of your gut bacteria, which is like the other little baby you have that you need to take care of in your body.
I love it that you put it that way. And I agree. It is incredibly fascinating. And the long-term effects that it helps on your immune system and the development of autoimmune diseases. And it's an exploding field of research right now. I think when it first came out, there was some skepticism. And now it's been embraced by almost all fields of conventional medicine.
Absolutely. So my listeners know they need to feed their turtle, their little turtle that lives in their gut that eats all those healthy dark green leafy vegetables and other plant-based foods. And it's their best friend. They have to take care of their turtle and it will take care of them.
And I always tell my listeners, remember, fiber is only found in plants. There are literally zero sources of animal made fiber that you can eat. So you have to eat plants and you have to eat whole plants.
Right. Refined means they refined out all that healthy stuff, like you already said, the folate, the B vitamins, and the fiber. So excellent advice. So to recap, we have an expecting mom, and she has lots of questions about how to support her baby. And, you mentioned that the nutrition advice you give to moms is pretty much the same nutrition advice we give to everybody with a few caveats, right? We're going to maybe boost our protein intake with healthy sources of protein. And we're going to make sure we're getting plenty of folate and those other good healthy vitamins, omega-3s. We're going to make sure we're staying hydrated. So pretty much standard nutrition advice plus a little extra. And that's going to really promote both the health of the mom and the developing baby so we can have a healthy pregnancy, healthy, happy delivery. And then when they come to me on day 3 or 4 of life and come see me in the office, they're off to a great start.
Absolutely. That's great.
Thank you so much for joining me today, Dr. Petz Kasper. It was a great conversation. I think it's going to be very beneficial to my listeners who are planning their next pregnancy or are pregnant. And I appreciate you sharing your wisdom and experience with us today. For all of my listeners, please check out the Healthy Looks Great on You podcast. It's a really well done, excellent podcast, a wealth of information, and I highly recommend it.
Thank you so much.
Thanks for listening to this episode of Eat Your Greens with Dr. Black. Parenting is a journey that comes with many challenges, but also much joy. I hope this podcast empowers you to set your family on the path to lifelong health. If you enjoyed this podcast, please hit the subscribe button so you never miss an episode. For more helpful information about plant-based nutrition for families and children, check out the show website, www.eatgreenswithdrblack.com. And don't forget to eat your greens. Please be aware that this podcast provides general health information about nutrition and feeding of infants and children and is meant for educational purposes only. It's not intended to replace the important relationship between a parent, child, and pediatrician. If you have concerns about your child's nutrition, health, or growth, please consult your doctor.